Hey, everybody. Thanks for joining us. We are doing the second Auric program, which is the adrenals, right? So that would be, what is that? Adrenal support is the blend. And so with the adrenals, this is tied to, being triggered, um, uh, high potentials for like fight flight responses, but also, in the notes that talks about asthenia, which is like depletion of the body, especially in the nervous system. But part of the issue sometimes with the adrenals being a bit overactivated is it can be associated with fatigue. As the body gets a little bit run down, say you're overworking or overdoing it or not sleeping well, or pain, you could be in pain. Pain is very fatiguing to the body. And the way that the body compensates for the fatigue is just starting to elevate small amounts of adrenaline to help your body, have the energy to get through the day. And this happens little by little over a period of time. And then pretty soon, the adrenals are working pretty hard because you're fatigued. One thing that happens is like you calm the adrenals down, and then you're like, oh, I'm exhausted. And you were exhausted before, but adrenaline didn't let you feel that exhausted. But over a period of time, this does start to cause some health issues. So anything that's related to like fight, flight, anxiety, um, here we also have like grinding of the teeth, chronic fatigue syndrome, high blood pressure, kidney disease, Lyme disease. You wouldn't think about it for Lyme disease, but also things like migraines, stress, um, bruxism and teeth, which is teeth grinding, also would be issues with the joint in the jaw, the temporomandibular joint syndrome. And then another one that you wouldn't really think about for this is colitis, but especially ulcerative colitis, where there starts to be like raw spots or spots where there's some internal bleeding um, because of so much inflammation in the gut. Right. So this is also very calming to the instinctive mind. It improves some kidney function and, helps you to feel relaxed, calm, and can deepen your meditation. When we look at it from the point of view of vibrational healing, we have the aura and the auric program and all the different aspects of the aura. But then when we go to the body directly, that's when we start looking at it from the point of view of vibration. And the vibration that this would be associated with would be your defense mechanisms. Always feeling on guard. Somebody made the comment over the weekend, this last weekend in class. It's like when they start to feel relaxed, it feels um I can't remember the exact word she said, but she said something to the effect of it feels like not okay, or it feels dangerous not to be defensive and on guard and like on edge, and that usually is a byproduct of dealing with a lot of chaos over a period of time, or, people who might have a lot of emotions around you, be upset, people throwing fits, at work, like a lot of times people being aggressive. Um, you know, I can think of in my particular case, like when I was younger, there was one person that you always had to walk on eggshells around that person. And it always felt like you had to keep your guard up because if they were having a bad day, everybody was going to have a bad day. If they were having a good day, it meant that you could relax a little bit, whenever you're around this person. And so, any version of this, like sometimes we are just unwinding things from the past. And so, adrenal work is always good. Overstimulated. God, if you look at the news this last couple of weeks, how could you not have a little bit of an adrenal reaction? Even if you're not living out in California, you might have family or friends out there, but it wasn't too long ago, it was the East Coast, with Florida and North Carolina being hit by the hurricanes and just the craziness on that side. So there's always something, you know what I mean? And so this is good for helping to calm everything down, but also to fortify the body for fatigue, to fortify the kidneys and the adrenals so that they're strong and not depleted. Okay. So with that, you have your blend adrenal support. If you don't have the blend, I mean, you can still follow along, but the issue is that the blends were made specifically for the Auric programs, which, you know, are a byproduct of, blockages in the physical body or the form, blockages or issues with the processes or your physiology, and then how you cognitively and emotionally respond to things, both in the environment and your surroundings and other people. All of these, you could say, are a kind of conditioning that then ends up causing these repetitive programs to run in your aura. So a single oil might not have a big impact. The only single oil that really is helpful for reducing an auric program is actually aloes, and not specific to the adrenals, but it does like a good general kind of cleanup, right? So, but if you want to produce the result, the blend was made specifically for that. Okay, so with that, we have a standard approach and we have an advanced approach. So here we're going to do both. The standard approach is good for maintenance, it's good for day to day, and it's what we use when we do what we call auric stacks, which is when we put 3 or 4 different auric programs together to go through and treat. And then the advanced approach is when you want to do a really deep dive on the particular program. But this is something you only need to do like maybe once a week. Once a week, maybe pushing it twice a week. You need a little bit of time for your body, emotions, mind, energy body to go through and process all of that. Right? So with that, begin inhaling. And we're inhaling on the whole left side of your body, left side of your face and neck, your left shoulder, left ribs, hip, all the way down the sides of the leg to the left outer ankle. Nice, long, slow, deep breaths. Nice, long, slow, deep breaths. Now do the front side of the body, your face, neck, your chest, your whole abdominal area, the front of your pelvis, down the fronts of your legs, all the way down to the tops of your feet. Now the right side of your body. So the right side of your face and neck, your right shoulder and ribs, your right hip, down the outer leg to the right outer ankle. And then the back side of your body, back of your head and neck, your whole back and hips, down the backs of your legs, all the way down to your heels. Then just pause. Pause and be still. Just pause and be still. Okay, so now we're going to do the advanced approach. And with the advanced approach, we do the direction, the quadrants, we do them reverse. And then we go down to the knees, ankles, and soles of the feet, which is a deeper release of the aura. And then we come back around and do it the way that we just did it. And then we do somatic programming, which is when we concretize or physicalize the positive pattern into the energy body and into our body itself, which that is the last step. So let's go through and do that. Notice how you feel, your body, your emotions, your mind. Notice if there's tension or, a little bit of low grade anxiety. Anxiety is one of those things that you can get, and tension, body tension, where you can get very used to it. And if somebody asks you, like, do you have any tension or a little bit of anxiety? And you'll go, no. And then you go through and you do a process and you go, apparently I did. Like you don't know you have it until it's gone. And so, that's very normal. Like all of us kind of have some version of that. And so even though, you reflect and you go, I don't really feel that wound up or anything, you go through and you start doing a process, you start to relax and you go, ugh, maybe I did have a little body tension, or maybe there was a little bit of anxiety, or, you know, so let's see what happens. So your awareness is on the left side of your body, side of your face and neck, your left shoulder, down the ribs, the hip, to the outside of your left leg, all the way down to the ankle. You're taking nice, long, slow, deep breaths. Your awareness is on the back side of the body, the whole back side, back of the head and neck, down the back, the hips, the back of the legs to the heels. Nice, long, slow, deep breath. Now the right side of your body. Your awareness is on your right side of your face and neck, your right shoulder and ribs, the right hip, down the outer leg to the right outer ankle. And then the front side of your body, your face and throat, your chest, down the abdominal area, tops of the legs, all the way, tops of your legs, the front of your legs, all the way down to the tops of your feet. Starting to combine things like in a not good way. Sorry about that. And then just pause and be still. Just pause and be still. Now, this next piece, we're going to start inhaling with your awareness on your knees. So you can do your whole knee, like the front, the sides, and the back, or you can just focus on the back of your knee. So either way, you're taking nice, long, slow, deep breaths with your awareness on the knees. Mhm. Yeah, that's a good one. Your awareness is on the ankles. And then the soles of your feet. Your awareness is on the soles of your feet. then just pause and be still. Just pause and be still. You're just being still. Now let's do the four quadrants again. Left side of your body. So left side of your face and neck, your left shoulder, your left ribs, your hip, down the outer left leg to the left outer ankle. Then the front side of your body, your face and neck, your chest, your abdomen, your pelvis down the fronts of your legs to the tops of your feet. Then the right side of the body. Right side of your face and neck, your right shoulder and ribs, your right hip, down the outer legs to the right outer ankle. And then the back side, back of your head and neck, your whole back, your hips, the backs of your legs, all the way down to the heels. And just pause and be still. Now, this last piece is the part tied to the somatic programming. So we've gone through and we've unwound the aura. We've made a shift in the aura and the auric program. And it's called a program because it's just a repetitive motion that keeps producing the same thing over and over again. Remember, the aura is an energetic mold or blueprint that eventually physicalizes into the body, the emotions, and mind. But also outwardly, it's the things that we attract and the things that we're drawn to. So here you're beginning to shift the mold, you're beginning to shift the blueprint. And, sometimes we make a shift and it feels good for a little while and then it kind of bounces back, right? Here, with this somatic programming component, this last little piece, that we're about to do. You're anchoring the shift into the body. You're accelerating the process, the shifting that's going to happen into the body, the emotions and mind, but also you're anchoring the effect that is tied to how we interact with the environment. The things we're attracted to, the things that we get projected at us. Sometimes, if somebody was being very aggressive, for example, to somebody who doesn't have that issue in the aura, they might be aggressive, and then the person's just like, yeah, that person's a jerk, and they walk away. But if we have the programs running in our aura that, you know, that kind of triggers that aggression, just continues and continues and continues in the physical body, and will keep going on for days, weeks, even months because of a bad interaction. Because things get triggered, things get agitated in the aura, and then also in the physical body. So we want to break this. This formula that we're using for the adrenal support, I mean, this is just a good example, is that this is what I used to use when I would treat people who had been in a substantial car accident, whiplash or some other kind of injury, because we'd be unwinding the condition, the injuries. And, on one level, they have aches and pains, they have areas that got injured, they're sore, but usually within 2 or 3 weeks, they start to have fatigue issues. They start to feel a little bit run down, their sleep's off, they start to have some anxiety, and it's because the body is still in fight flight. They're still in that feeling or thought, that reaction to the car accident, even though it's been weeks or sometimes even a month or two. And so this is a way to regulate the adrenals, strengthen the adrenals, strengthen the body, right? So even just doing this as general maintenance sometimes can have a very fortifying effect, I guess is what I'm trying to say. Doesn't have to be for a particular reason. Sometimes you just go and do a little tune up so I don't feel run down, so I don't feel fatigued, or I don't feel so defensive, or sometimes it's not necessarily that even that your adrenals are overactivated, it's that they become hyperreactive. And so what happens is, before it took this much for your adrenals to like kick in and for you to go into fight flight. And when they become hyperreactive, it's like just like that, you know. And so anyway, so this last piece is the somatic programming component. So your awareness is on the brain. You're taking nice, long, slow, deep breaths with your awareness on the brain. Now do your spine. Your awareness is on your spine. And then your awareness is on your brain and spine both at the same time. And then the brain and the soles of your feet. And then you're going to inhale, moving your awareness up above the ankles, and exhale, moving your awareness down into the earth. This is referred to as chakral breathing. Your inhale, moving the energy up, and then you're exhaling, moving your awareness down into the earth. This helps mix the energy with the earth. And then just pause and be still. Notice how you feel, your body, your emotions, your thoughts. What do you notice? How do you feel? What's happening with your mind, your thoughts? Does your body feel different? Let's go ahead and unmute ourselves or type in. Can share experiences and process. We'll do that, and then we'll slip into our normal Q&A.
Yeah, go ahead, Denise, then Ralph.
Hey, Denise.
Hi, Greg, what is in the adrenal support, the blend that you're
It,
making?
it is. Let's look it up just to make sure I don't start making stuff up. So it's Ravensara, and Ravensara is very good for like energy levels, but not like it's not stimulating. It's like more fortifying. And Ravensara, it's an antiviral and good for things like that. But one of the things about Ravensara, like there's this term in medical aromatherapy where they call it like an environmental treatment. And that just kind of means that it's not necessarily about chasing after a symptom, but it just makes like the body function better. And it's not necessarily, excuse me, like a body stimulant, but it's so fortifying that it just makes everything like a better version of itself. You know what I mean? So Ravensar is quite nice.
Is it the one with the T, Greg, or the Sarah?
No,
Or
it's the Ravensara. Yeah,
okay, thank
yeah,
you,
yeah.
thank you.
Yeah, I don't know why people did that and named those two oils. Because the other thing is they're a little bit similar, but then they're not, so just to make it extra confusing. And so then it has Thyme Linalool, which Thyme Linalool is it's a form of thyme, and it's a different what they call chemotype of thyme, and it's a much softer, gentler form of thyme. So it's great for even like children, but it's great for like long-term use. It's very soothing. It doesn't really generate a lot of heat, where like some people might be sensitive if they put like red thyme or white thyme on the skin directly. It would just like maybe irritate it a little bit. It doesn't me, but I mean, it definitely can.
Okay,
Time linalool, you could go crazy with it, putting it all over your body, wouldn't irritate the skin at all. It's very, very gentle. And so then there's basil, which basil and thyme both are very fortifying to the adrenals, the stimulating adrenal function, which, when using herbs or oils, when you say stimulating, it just means improving the function. It doesn't mean like a cup of coffee or, a couple cups of espresso and where you're like, "Eh." It just means it's making things work better, like to their highest potential. And then the other part of basil is it's one of the better things for undoing the effects of stress. And it's like a cognitive stimulant as well. It makes your mind work better.
wow.
There is just a hint of oregano. And oregano is actually quite good for energy, but it also is very toning to the sympathetic part of the nervous system, which when that part loses tone, we're always talking about vagal tone and rest and repair and everything. But when the sympathetic part of the nervous system, which is action, activity, fight, flight, all those kinds of things, um, when you lose tone there, you tend to get stressed out a little bit easier. Your body doesn't quite work as well. You can actually even start to have motor function issues, like
Mm.
hand-eye coordination or motor coordination can diminish quite substantially. And you can start to lose like sense of balance, and there's even a thing called sympathetic dystonia where you kind of your nervous system goes out and you kind of have these periods where you kind of like start swaying, and it almost looks like somebody starts, like when they have it, they look like they start dancing,
Huh.
but it's like they're like swaying to some music that's not there, and then they'll fall or drop down to a knee, and it's just because their nervous system's not working quite as well.
Wow.
Almost like they go into like sleep mode but standing up, because they start to have like excessive fight rest and repair, and it's not being balanced by the other system, and so they kind of get a little bit of uh like the spins, or a balance issue, like inner equilibrium in the air can go off, and so it's not the only thing that can happen to the inner ear, but it's one of the things. And so there's just a hint of the oregano. Oregano can be a little too strong sometimes. It's always kind of good to use in a blend. I mean, you can take it straight, like in some water and something if you were really sick, but it's not something you'd want to use long term without blending it. Sometimes when people do a little bit of oregano and not enough water and stuff, it'll cause like a burning sensation, especially down by the navel. Just because it's got so much heat to it, so it's so hot, and
Wow.
it can be a little bit caustic. And so, you know, all the other oils together, there's 27 parts of that, and then there's just one part of oregano. So it's just like a hint. It's like if you salt and pepper your food, it's got just a little tiny bit of salt, but not massive amounts. And so this blend is very fortifying. And I mean, it was something that had gotten developed when I was treating a lot of whiplash patients. I mean, I'd always had that formula, but I really fine-tuned it when I was dealing with whiplash patients. And with whiplash, they'll get an injury and the degeneration keeps happening. So you chase after symptoms, but the degeneration keeps happening. And so part of it is the body's still in fight flight. You're starting to lose some of the tone in the sympathetic part of the nervous system, which is the fight flight mechanism, because it's like it's overworking, and the body starts to get fatigued, and they go deeper and deeper into like an inflammatory state. And so, sleep gets thrown off, all kinds of things get thrown off. And
Can digestion get thrown off
no,
too?
digestion definitely would. Digestion, blood pressure, headaches, migraines. Doesn't mean that this is necessarily a cure for those things, but it definitely is helpful and is definitely something that you would use to prevent the body from going into those kinds of conditions, or slowly over a period of time, it's what helps pull the body out of that kind of thing. And so it's a pretty solid blend. Like, you could use it in the Auric program, or you could also use it like as a body tonic. And I mean, sometimes in the old days, I would have people take it internally. Like I would have them take 2, 3 drops a couple of times a day if they had been in a car accident. And people who thought that all this oil stuff was a bunch of BS, like, clients that I would have, they'd go, but that one blend really worked. Like I had more energy, and this is the blend. I mean, this is exactly the blend. And so it's a way to fortify the body without generating a lot of heat and without being like over energized or feeling wound up. It's calming, it's gentle, it's soothing, it's fortifying, in a way you could say it's balancing. Uh,
Well,
and even though you're increasing energy levels and fortifying, it's kind of soothing, like because you are regulating the adrenals somewhat.
it feels like a warm blanket in a way.
Yeah. Yeah, that's a great way of putting it.
You
Like,
know, as
like you want to just get all cozy and,
yeah,
but
especially after a whiplash or an
yeah,
accident like that,
yeah, yeah,
you almost need that stabilizing.
yeah.
So,
I,
uh,
I,
eh,
I, I would say after any big traumatic event, whiplash is a physical event, but, say you have a blow up at work or there's some big weird thing that happened and, it's super emotional, or even you see something in the news and you're super upset, at first you're going to calm down, but sometimes like the effect of the traumatic event will continue to keep your body in defense mode, and eventually you'll start to get tired or fatigued. And so it's a way to regulate the adrenals, offset the fatigue, fortify the body, and kind of calm and soothe the emotions and the mind. Yeah.
and you do the body tonic, and I guess, if it really need be, maybe a little bit internally. And would you, is this an inhalation one as well?
Yeah, oh, totally. Like how we're doing it right now, you could inhale it. I mean, when people felt uncomfortable about taking things internally, I would just have them inhale it. I think back in the whiplash days, if I remember right, I didn't do too many like body tonics. I either had them take it internal or inhale it. Putting it on topically, it depends on the population you're dealing with. And back then, when I was working on whiplash patients, they weren't people who were involved in anything holistic. I was actually working with an ER doctor, and so I was getting just these people that I've never known. n- it's not like I knew them and would have conversations with them. I was just some weird guy that she would send them to. And, so most of them I could get to inhale, but, if they were really, jacked up, I could get them to take it internal. But for the most part, they were not people who would, take herbs or vitamins or anything like that. But they would feel so good right off the bat that they would keep doing it because it produced a result. That's the only thing that kept them doing it.
Thank you. No,
Yeah,
this is excellent. And I have had a sideways whiplash, and it took a long time. I'm not
yeah,
even
it
sure
does.
if
Yeah, it
this
sure
wouldn't
does.
work quite well for me now, quite
Yeah,
frankly.
yeah.
Thank you.
You're so welcome.
You can go ahead, Ralph.
Hey, Ralph.
Hey, Greg. Okay, so we've gone through and we've done the advanced approach here on adrenal support.
Mhm.
So maybe not if we want to review adrenal support during the week, we do the standard approach. But
Yeah,
unless we were really feeling our oats, probably not try the advanced
yeah.
approach this week.
And I would say it would depend on the person. I mean, you do enough oil work and everything that if you want to do it a couple of times a week, that would be fine.
Okay.
But like for somebody who's like maybe a little bit newer, once a week would probably be good. But if you wanted to go at it a little bit tougher, you could do that. But then I would still just do maintenance after that, in between. And it doesn't even have to be done every day. But you'll notice that your energy levels, it's not like you have this burst of energy like, oh, I inhale it and now I'm going to get up and clean the house or something. You'll just notice like, okay, I feel really relaxed, but in the next few days you'll notice I'm doing stuff more, I'm more active, I have more endurance, I have more stamina. I'm not having to stop because I don't feel good. That's the way that it usually works for me. Is like I inhale it and I go, yeah, I feel good, I feel relaxed. But then I notice in the next couple of days, I'm more dynamic and I'm more active. Where when you're starting to feel fatigued, it's like I need to know all the information before I get up from this chair. Where when you're feeling good, you just get up and start doing stuff, and you don't really think about it. And so that's my experience with it is like you're up and moving and doing things. And if somebody says like, hey, could you help me with this? You know, you pop up and just start doing it without thinking about it. But when you don't feel good and you feel tired and fatigued, you're like, okay, yeah, let's do this. What are we doing again? Like,
Yeah.
you're trying to psych yourself up or generate the energy to do it. And so I would say in a way, it's not like a medical term or whatever, but it's almost like you're more spirited. Like, you get up and you just start doing stuff and being a little bit more dynamic and there's this uh inner drive to do things that maybe wasn't there before. Pain will suck that right out of you. Like,
Oh yeah. Oh
you
yeah.
know, I
Mhm.
just so many times, like, dealing with pain or an injury and you just go, okay, yeah, I guess I'm just getting older or whatever, which is true. Like, for me, it's like it's true, but a lot of times it's because, the body got really beat up when I was young. And so when I do something like this, all of a sudden I notice I don't think about like, I need to get up and do this, I need to do that. I just start bouncing around and doing things, and then I'll go, yeah, like I apparently I'm feeling better. And I have a little more stamina, I have a little more endurance. I'm not wanting to, sit down and rest for a minute before I do a next like big physical activity. I just go from one thing to the next to the next. And you know, yeah. I mean, it's helpful. It's not a magic bullet where it's going to fix everything, because like
Mhm.
whiplash is a good example. Still got to treat some of the symptoms,
Mhm.
like, yeah, if you have an injured neck and shoulder. But I noticed that using this blend, that the the person responds better to treatment and gets better effects for the conditions that you're treating because the body's not so fatigued. Like if the adrenals are super overactivated, you don't really respond to healing or a healing process very well. There's a few things you look at, like why isn't this person getting better, or why am I not, feeling better with all this? And you look at agitation in the body, but one of the things is you look at adrenals, because even if you look at it from an energetic point of view, like why, you do some work on somebody and it's like, God, why isn't this person, responding better? Because it could be very multifaceted. It's not always like one thing, but I always like to try to go, okay, what are potential problems? And one of them from an energetic point of view is the Ming Men. The Ming Men super overactivated and it causes congestion in the body and it keeps depleting the lower centers and trying to send energy up to the higher centers because that's what the Ming Men does. But the Ming Men also is tied to the adrenals and the kidneys. And so a lot of times when there's Ming Men issues, there's usually adrenal issues. Yeah.
Okay. All
Yeah.
right. So in doing the standard approach,
Hmm.
um, can we do the standard approach and then do head, torso, hips down?
Sure.
Okay. So that will be sort of a standard approach plus one kind of a
Yeah. Yeah.
thing.
Oh, totally.
Yeah.
And one of the things that you could do, like, because it sounds like you want to explore it a little bit, like you could totally do that. But like if you have areas in your body, like you go, okay, my hips and my psoas and my low back, they're a little shaky, And so part of what's happening there is, for one, they're probably a little bit depleted, and two, especially with pain syndromes, like that itself will target and activate the adrenals. Like anytime you have pain, it starts to kick your body into fight flight. And so one of the things that I used to explore with some of the patients was that we would not just look at trying to calm the adrenals down by like a general approach. I'd have them spend time like, okay, you have a hip problem. Let's go into the hip. Like inhale it, but into the hip. And just like how we do our processes.
Right.
And you have some knee problems, inhale it with your awareness on the knees, because you're unwinding the tendency in the body to overstimulate the adrenals. So if you have like a hot spot, you go, okay, let's hit that hot spot. You know,
Okay.
it's kind of like what in like the colored healers, from the Foundation for Mystical Healing, like
Yes.
green kind of does that, blue kind of does that, and violet does that, the violet healer. And they'll calm down the tendency for an area to activate the adrenals. And so, there's different things that we do that do that. But this is one of those things that if you're going through and you're doing the maintenance and you go, but oh God, my back's a little wonky today, you know, you don't want that back to like keep kicking the adrenals into overdrive as you're laying down and going to sleep. Because especially with pain patterns, people will start to develop like a phobia for like bedtime, because they have experiences of not getting good sleep or not feeling good. But during the day, say you have a hip that's hurting or something, you have the distractions of the day. But then when you lay down, you don't have the distractions, and so the pain in the hip becomes more magnified because you don't have the distraction. And so what will happen is people, as they get ready to go to bed, especially when it starts to become more chronic, which means longer than 30 days, they'll start to have a little bit of like first stress and anxiety, but eventually it will turn into a phobia about going to sleep, going to bed, because they've had so many bad experiences. And so if you look at them from physiological point of view, as they lay down, their adrenals start to kick in. Like they're starting to have overreactive or hyperreactive adrenal activity as they're laying down and starting to rest. And so even if you look at the idea of like how do you wake up in the morning, you're in this deep sleep and then all of a sudden you're like, oh, I'm kind of waking up and coming out of it. And, that's a little bit of adrenal activity kicking you out of your sleep to get you up and going in the morning. And so, um, when you're having like pain syndromes and things, the adrenals will start doing that right as you lay down. Like, because your body has the bad experience of laying down and not getting good sleep. So your adrenals go, just get up and move around. Just get up and distract yourself some more. It's just like a survival mechanism. But I would say even further that, how sometimes, there's times in the morning, especially when I was younger, like when I would wake up in the morning, I felt like a lame cow, like just
Oh yeah, I was that way, and my mother absolutely
right. And
liked
then
to
there's
beat the shit
times,
out of me for that.
yeah, yeah. And then there's times where you wake up and you're like, put me in, coach, put me in. I'm ready to go. Like that really is about adrenal activity. You've had some rest, but the adrenals aren't functioning properly when you wake up and you're still feeling sluggish for a period of time. And I as I got older, I started reflecting. I was like, yeah, that if I look at that pattern like over several months, I've been feeling kind of crappy for a little while, and then all of a sudden I just getting up in the morning was really hard. But if the adrenals are regulated, then when you wake up, you get that little burst of adrenaline to get you up out of bed, and you're just like, okay, I'm ready to go. And that adrenaline doesn't stay going. It just is a little like wake up call. It's like a little inner alarm clock. And so, even if waking time is having a hard time, I would do the adrenals. But here's another one, and it's not necessarily like a condition like what we're doing here, but this is a little bit more of a functional problem. So, I'm going to do a whole nother layer of other things to treat in the Auric programs, but memory is also tied to adrenal function. And so, like, you might have certain memory issues where if the adrenals are depleted or they're over, if they're hyperreactive, you might not have quite memory issues, but if they're depleted, you'll have memory issues because part of memory is actually tied to fight, flight, action, sympathetic nervous system activity. And if you don't have that, you really don't form memories like you should. And so even like memory issues can be considered a bit of an adrenal issue.
Wow.
Yeah,
Okay.
yeah.
All right. So I'm having ongoing problems with my sternocleidomastoid. So run the adrenal support program process on the
Yeah, I
sternocleidomastoid.
like that for that, because um, you know, it could be from an injury, could be, sternocleidomastoid issue. Like everybody really has it to a certain degree, but when it starts to be a problem, like you said, it. And so I would say that if the sternocleidomastoid is real tight, which is that those two rope muscles that come down from behind the ear down to the sternum and the clavicle.
Those are the ones.
Yeah.
Yep, them.
So, for those who don't know what that is, but um, when those are tight, I would say there's an adrenal issue. Like
Okay.
the adrenal issue didn't really cause it, but because they're tight, that there's going to be some sort of little bit, not massive, but there's going to be a little bit of an adrenal issue.
Okay.
Yeah. So you're right on track with what you're doing.
Okay.
Yeah.
All right. And my other
How is
question.
the neck doing, by the way? Is it unwinding or are you feeling?
It was unwinding a little bit, and I've noticed the past at least couple of weeks it's been constantly tight and uncomfortable. Constantly.
Hmm.
And I'm also having the problem of not being able to walk down the street straight. I'm finding that
Yeah, that's a
I,
sternocleidomastoid issue, right?
I find that I'm forever weaving down the street like I've
Yeah.
been drinking.
And the leg will like one you'll be going like this and then a leg goes like this.
Yes.
Yeah, that's a sternocleidomastoid issue. Yeah.
Yeah. Okay.
Yeah, so lantana, even the thyme linalool, like put a little thyme on there, a little vetiver. I mean, I'd explore the different things, but also unwinding the diaphragm a bit, all the things that we do. Like if you just keep doing it, we'll get there. And then the vetiver at the base of the skull and everything like that.
Yeah.
All of that should be helpful.
Okay. All right. Okay. I got one more question on trees, but
Sure.
I'll ask that one later.
Okay.
Or do you want me to ask it now?
Let's do the ORC program first, and then we'll come back to it.
I'll come back. Okay, good. Thanks.
And this is great Auric program, just so you guys know who are just come in or we're still on the Auric program doing the adrenal questions or shares or whatever you want. And go ahead, Terry Lynn, then Letty.
Hey, Terry, then.
Not quite. We can't quite hear you yet. Let's try. I don't know.
There we go.
Hey,
Hey.
there you are. There you are.
Thank you. So fabulous program tonight. I'm really, really grateful. You keep talking about how pain affects the adrenals as
Oh yeah,
well.
yeah.
Um, so I'm focusing on that. And I don't know if you remember, I have MS. So
Oh yeah, yeah,
I have a lot of pain
yeah,
constantly every day. It's a it, it doesn't end ever.
yeah,
So
yeah.
I'm wondering if you had a thought about how all that interacts with my adrenals and if this
Yeah, it
is
would
a
be constantly stimulating the adrenals. And there's an approach that they do in Germany. Like it doesn't really tackle the MS so much directly, but it's an attempt to deal with like the effects of the MS, and they'll use lemon verbena. And lemon verbena, anything that has a like kind of a lemony scent is always kind of relaxing and soothing to the body, but uplifting. But the reason that they use the lemon verbena is it's calming and soothing, but it also is very fortifying and regulating to the whole endocrine system. And so the
yeah,
idea is kind of where you're going with it is to try to help, regulate the adrenals when you're dealing with the different kinds of, pains that keep popping up in the body and everything. And um, the the approach with the adrenals or the approach with lemon verbena, it's just helps keep the body in a more stable place as you have those issues with the MS.
thank you. You had recommended lemon verbena because my face was really slouchy.
Uh-huh.
And and you recommended rubbing it in to my face, and that I don't know. Do you feel like I feel like it's better. And so grateful for that. But then I stopped using it. Um, so are you thinking lemon verbena
I
or
would
this
use
process?
for
What are you
you with MS. I would use lemon verbena. It doesn't have to be constant like every day, but I would use it pretty consistently. Like, you
Oh,
might go through periods where you use it for a couple months and then you take a little bit of a break. But it's like going to be one of like if you had a desert island, your top five oils, lemon verbena would be one of your top five oils.
inhaling or internally?
Inhaling, I would even take a few drops internally, daily for periods of time. I think you'll find that like kind of calming and soothing, but also that effect on the glands and the endocrine system, which would also impact the adrenals, would be quite helpful. So
Okay.
yeah, I
That's
definitely
the
do
end
that.
of my question. Thank you so much. I
You're
really
so welcome.
appreciate you and
Hey, keep us
everything you
posted. If you
do.
ever need to troubleshoot any of that stuff, you let me know.
Yeah, you had mentioned that you did a private consultation kind of thing. Do you still do that?
Yeah, she'll post the number and like text me and we'll get you into the schedule at some point.
Okay, Sam, so can you email that to me, that number, and I can text him?
Yeah, absolutely.
Um,
Robert did
okay,
post a link in the chat too, but I'm happy to email you.
okay, cool. I get paid on next week. I get paid next week, so I would love to chat with you. And I
Okay.
hate to dismiss it away from this session. That was fabulous,
Oh,
even though my cat was all in this. Like, so thank you.
you're so welcome.
I liked the cats.
Yeah, yeah. Sam was telling me like she has such a cute cat.
He is so lovely and so wonderful. And whenever I sit in this chair, I am his territory.
Right.
So, yeah, yeah. And you didn't hear the dogs barking. You missed out on that.
No, we
So,
did.
yay you. Thank you.
You're so welcome.
And then go ahead, Letty, then to Tajal.
Hey, Letty.
Ooh. Hi, Greg. Hi, Sam. So my question is not related to the practice. So or is there
Well,
anybody?
Yeah, we still have quite a few chat questions
Okay.
related to this.
Yeah,
Yeah.
so we'll come back around.
Yeah.
All right.
We got you and Ralph in the queue, so I'll call on you guys when we're done with the adrenal talk.
Okay, thanks.
And go ahead, Tajal.
Hey, Joe.
Hey Greg, how are you?
I'm doing good.
Okay, so I have a question regarding this fall. Like last November, I fell down in the kitchen while working,
Uh-huh.
and my balance went everything, my weight, body weight went on my left side. So left side of the body. So I
Uh-huh.
had a full left side was paining, but now I have pain in my left shoulder and the arm and the left leg, more towards knee area. There is a swelling which is not going on.
How,
And
how
at
long ago did the fall happen?
November last week, like last year.
Okay. And so when you just did this protocol with the adrenal support, how did that make, I know it's not necessarily a pain reliever, but did it help your body to feel a little more relaxed or a little bit better?
Yeah, I feel light, and internally I felt like my body is in the shock. It need healing, kind of, or some kind of relaxation. And what happens in between, like my hand becomes very stiff, like left side. So I have to support to lift my left hand with the right hand. And then last Tuesday, my right hand become exactly the same side where I have left hand pain. It is exactly the same side of my right hand.
Yeah. So I would keep doing the adrenal support, but it sounds like you have some tension around the muscles and things around the vertebrae in your neck. And so I would put things like marjoram on your neck. Keep doing the adrenal support, but do things like marjoram, and then things that are good for pain, like so pain soothe or the pain relief neuropathic would be super good. And then you could also nerve soothe would be another one. Like so between those three and doing the adrenal support, it should be quite helpful.
Okay, and one more piece is like last, I think Thursday, one of my friend has done healing on me. So while healing in the evening, I felt very cold and the chill then. And after that, like below my throat, my whole body becomes stiff. I cannot move. I cannot do anything.
Yeah,
And there was a lot
that's
of
still
pain.
that's still the issue that we're talking about. Like
Oh, okay.
you're
So
having
now,
manifestations, like you really treat the neck, like you're especially the back of the neck and the sides of the neck. Really
okay.
treat the neck,
And
even a
do
little
you,
bit of like the top of the shoulders and things, and then keep doing the adrenal support.
do you think any muscle tear or anything? Like I have done the MRI, but my report is not yet
I
came.
think there's some issues in the spine, so just keep loosening up the spine. Yeah,
Okay.
yeah.
Okay. And I'll also
Okay,
message for personal one-on-one help and you
okay.
can help me out. Thank you.
You're so welcome.
So this question came in right kind of when you were first talking and going through the different things with the adrenal support.
Mhm.
And they said, what about depletion from chronic use of prednisone?
Yeah, it would still be another thing that you could do. Um, with something like that, you could use the adrenal support by itself, but I would probably do it also internally for something like that. Because the prednisone and opioids will like either cause depletion or cover up depletion. So I would say maybe take a little bit of adrenal support internally for a little while. Like 2 or 3 drops in water, like 1 to 2 times a day. And that should be very helpful, but it would be a long-term approach. So do it for like at least 30 days, maybe.
And that's great. That actually answered a different question, which was, can we take adrenal support internally?
Yes, yes. Yeah, definitely.
Is it beneficial to do men and stabilize after this?
Yeah. That's a thing from this class over the weekend. you could definitely do Amen and the stabilized blend after that. You just inhale it, but it would continue the manifestation of the shift in the processes that you're put in place. So yeah.
So earlier you had given us a tincture for to help like augment and utilize doing the ARC program.
Mhm.
Which tincture was that?
So there's two different tinctures you could use here. One is the aloes, the spagyric aloes tincture, or the spagyric mimosa. Either one will help any and all of the Auric programs.
Would you take that before, after?
Yeah, either way.
Either way.
Yeah, yeah.
Question, is this safe for people with hypothyroidism?
Yeah.
Because I noticed my thyroid throbbing when inhaling this blend. Also, could this oil be used topically for teeth grinding before bed?
Over a period of time, you know, part of the teeth grinding is that your body's in defense mode. So it would be something that you would put in motion for that, but it might not resolve at all, the teeth grinding. Part of that is the body is in a lot of like defense mechanism oriented processes. And so vibrationally, that's known as resonance. And we're going to be doing a whole class on that in February. But it's just about calming down all the defense mechanisms in the body, the hyper reactive or hyper vigilant defense mechanisms. And so this would be helpful. It's not going to completely knock it out, but it would be helpful. Yeah.
And one more,
Mhm.
could I do this protocol before I do physical activity that might agitate my whiplash? I had a car accident several years ago and have noticed that my whiplash comes back if I do a lot of back and forth movement.
So, yeah, like part of what happens when you have excessive defense mechanisms or you have an injury, or, again, here we're talking most likely also about fatigue, is that one of the byproducts of fatigue is that as you're doing things, your body starts to get tired. So then it starts to make these choices about like, okay, when I'm walking, I'm really going to engage this leg more than the other leg just to try to reserve, some energy. And so what starts to happen is you start to have muscle imbalances and you start to have a little bit weird interactions, and things will reach a threshold very quickly and then kind of go into a spasm or shut down. And so, again, it might not be the complete treatment, but definitely it would be a big piece of the treatment, trying to fortify the body so that you can have more energy to go through and do things. And as soon as the body gets fatigued, it's going to start causing some of those problems. So it's a way to diminish the fatigue so that your body has a less likely tendency to go there, but you still might need to treat the neck with things like marjoram and vetiver and lantana, things that will help unwind the neck. But I would say that does sound like you got a bit of fatigue there. And so as soon as you start working things, the thing that I like about using vetiver, spikenard, valerian on areas like that is myrrh is another one, is it will help to unwind muscle imbalances. And so if you've had an old injury and there's some fatigue there, like the combination of the adrenal support with some of those other oils will help to unwind the muscle imbalance and improve energy levels and endurance and stamina when you're having physical activity.
So great Q&A, guys, shares and everything. That does finish up our adrenal support week 2. Hope you guys are enjoying. Just so you know, Troy, there's a couple people ahead of you, but we'll go ahead now and start with Ralph, then Letty, then Troy, then Lolly.
Okay.
Okay, Greg.
He
the trees oil.
Yes.
Is that, I know we inhale that. Would we use that topically?
Oh, you'd use that topically. You could make a body tonic or an ointment. I find body tonics were good or just neat, like a
Okay.
few drops on. And the thing that's nice about that, I mean, that's another thing you could actually throw directly at the neck, but I'd also put it down like on the solar plexus area just so it hits the ribs.
Mhm.
Is it's reducing again the defense mechanisms, which is kind of what we're talking about with the adrenal support. But part of our defense mechanisms is that the fascia like tightens up, like
Yes.
it's not wanting incoming in, anything incoming to go deep to the bones or to the spine or to the neck. So in a way, the fascia kind of tightens up to try to splint an injured area, even though it might be 20 years old. It's like, well, if I stay tight, the neck won't move as much, and so then it won't hurt as much. But it's just a reaction. It's not necessarily a long-term strategy. And so the thing that's nice about the trees is it's kind of like the fascial release where you use it diminishes the defense mechanisms, and it helps to relax and release the fascia and calm everything down, and is also very fortifying. And so very fortifying to the nerves and things like that. And so even with what we're talking about here with the adrenal support, that could be a thing that you use with that. Like it would be good on the neck, the chest a bit, and then even down on the solar plexus or diaphragm area. It could be quite helpful. I mean, I put trees on 2 hours ago. Like, I was like, I'd been super, super active, and uh like my mid back was starting to feel wound up because I was like bending and standing up and then reaching. I did that for several hours, and I'm starting to not feel very good. And I put some of that on and just lay down and let my back rest for about 15 minutes, and I mean, night and day difference. And the trees aren't really like a pain reliever or an antispasmodic. I mean, it has all of that, but it releases the fascia and it diminishes the the defense mechanism. And reflecting on what was happening is I was pushing a little bit harder than I normally do, and
Yeah.
the defense mechanisms in my body was like, hey, slow down, turbo, calm down. Like you're getting a little sassy, you gotta need to calm yourself down a little bit. And I was like, yeah, whatever, I'm gonna keep doing this. And then all of a sudden I hit this wall where I'm like, I'm not feeling so hot. Putting trees on pulled me right out of it. Pulled me right out of it.
So for someone that's had a recent injury of some sort, putting
Yeah,
the
yeah,
trees on.
totally. Yeah.
Okay.
Yeah, like your wife with the knee thing. Hey, how is her knee doing, by the way?
Her knee's doing very well.
Nice.
All the
I'm so
swelling's
happy to hear
down.
it.
She's got full motion back. She's
Good.
feeling pretty spunky about it.
Good, good, good.
She went to see her trigger point therapist yesterday,
Oh,
and
tremendous.
the therapist said you still have some swelling in the area, so have Ralph continue to put the oils on, but
Beautiful.
it's looking very good.
Good. I'm so glad to hear that.
Yeah, yeah.
Yeah.
Okay. All right. Well, Sam, I'm going to put in an order tonight. So, all righty. Thanks.
Hey, take care. And then I think Letty, is that who is next?
Yes. Hi, Greg.
Hee
Hi, Sam. Want to first of all say thank you for my gift that I got. Happy cord cutting, Sam said. Now, now I need to learn how to use it. Does it have like a particular name, or it's just what is it? Just an
It's a knife.
Yeah,
It's
it's
just
just
like-
a knife that
got super charged up.
sat on a statue in a shrine for quite a while, and so it's
Wow.
supercharged.
All right. Thank you.
Thank you for
So
all
I
the
just-
work that you do, and help with the booklets and everything.
You're welcome.
Yeah.
So I had a question. I know, I think a while back, Greg, I had asked you about, I was telling you that Ruben, he gets a like a burning sensation in his jaws when the only time he gets it is when he eats and drinks an alcoholic drink together. So it's kind of, I guess, like TMJ. So did you say marjoram for that?
Marjoram, but the other thing that I would be like a little bit curious about is like sometimes that jaw thing can flare up because of a little bit of dehydration. And so, that it's with an alcohol, a little bit of alcohol. Like alcohol can be a little bit dehydrating. I mean, not massively, but if he has a bit of a problem there, I would try marjoram. But how we're even talking about like this adrenal support and the trees. I mean, it's helpful. Like the thing with jaw issues is it usually is. The body is in defense mode. And so even if you look at dehydration a little bit, that's still the body is in excessive fight, flight, or sympathetic nervous system activity. And so marjoram would help calm down and pull him out of fight, flight, and help tone up parasympathetic, which is rest and repair, and it's antispasmodic. But I would say there's still probably other things that need to happen, like the trees and vetiver along the base of the skull. And, I like this idea of like maybe using the adrenal support to calm down his adrenals a little bit. And, you know, um,
No, he probably wouldn't be up to like doing like a protocol. So just putting it on the wrist would be okay.
or which part?
For the adrenal, like if
Maybe internal, like have him take it internally. The wrist will do a little bit, but it probably won't do enough.
and the vetiver, like you said, along the skull, right? All along
Mhm.
it. Okay.
Yeah, on the base of the skull.
Okay. So, and I think another question that I had asked a while back was the like there's a lot of sweating, and you had said sage. Is that still like the case for him?
Sage can be, and we're still talking about him.
Yes.
Yeah, sage can be helpful, and then if it's a lot of excessive sweating like in the armpits and the palms and soles of the feet, cypress can be helpful. If the excessive sweating's like on the forehead or the abdominal area, like not the whole body, but just in those two spots, that's a disturbance in the autonomic nervous system, and something like anise or lemongrass, something like that would be helpful to balance those things out.
And the anise and lemongrass, would those be internally, or those could just
Internal,
be
internal. Those would definitely need to be internal. Yeah. Does he have any heart issues?
not that I'm aware of. He's been getting a lot of like heartburn lately, but not heart issues that I'm aware about him now.
Yeah, the heartburn, is he getting like kind of like tightness in the esophagus, like when he's chewing food or taking something? Is it like really slow going down and feel like it's getting stuck?
Honestly, that I don't know. I haven't asked
Okay.
that.
I would ask him that because again, that would be his body's in super fight flight. Yeah.
So, if it's in super fight
Yeah,
flight, then
all the same things we're talking about. Yeah. Yeah. We would just be evaluating how bad it is.
okay.
Yeah.
Thank you, Greg. So I have another question. I have a coworker that um has a daughter that she goes there to school where we work at, but
Mhm.
she's had suffered from like depression and like anxiety for a while already, but like he seems like he's really frustrated with her because like I don't know, like she does all these crazy things, but I'm just wondering like is she, because I think one of the days that it was time to go to school, like she was fine or whatever, but I don't know like if it's like the following morning or whatever, but she threw up, and then he's thinking like that she's making herself throw up so that she doesn't go to school, because it's like a big dilemma for him, like trying to get her to go to school, like she just doesn't want to go, like she's always complaining.
How old is she?
She's like 15, I think 15, 16.
Mm. Yeah, I'd probably start with tarragon with something like that and just calm the emotions and she probably at that age, hormones and school and being a teenager, there's probably a lot of ups and downs with the emotional body.
Hmm.
It's just kind of will calm down some of those things and the effects of those things.
Okay.
Yeah.
Okay. And then another question I had was about his dad. He had asked me about if there was anything for his dad has kidney failure, and is there any oils for that, or it's mainly
Or
just
what is it?
kidney?
Oh, that's a rough one. I mean, your best bet is to give them kind of decent sized dosages of cordyceps, but that's a rough thing to treat.
Okay.
Yeah. Like try the cordyceps.
Cordyceps.
Yeah,
Okay.
the tincture. Yeah.
Is
Like two couple dropper fulls like 2 to 3 times a day.
okay.
Yeah.
Greg and I had just had one more question on parents that come to our school, like, well, meetings that have to have meetings with me. Is there anything I can do to like calm some of these parents down? They're not so not aggressive, but I'm just saying like they want like a little demanding, like they want to check like all the data of the student, all the work. I'm thinking, sometimes I'm kind of like, just feel like it's a little bit too, they're asking for too much.
That's going to be a tough one to address. Just do things that are kind of relaxing and soothing in the environment. Like even just lavender and, just things that are soothing, calming, so lemongrass, lavender, mandarin, things like that. Just diffuse it in the room.
What if some of these people are over the phone?
Um, yeah. Yeah, that's a tough one.
That's a tough one.
Yeah.
Okay.
Yeah.
I did have a kind of an advocate that did come in she came in kind of like a bulldog, but I'm thinking we're not trying to hide anything. We're there for the same thing. We want, everything, the best interest of the students. But sometimes they're just a little too demanding. It's a little overboard. But
Yeah.
okay. But I'll try at least that. Thank you so much, Greg.
You're so welcome.
Thank you.
And then go ahead, Troy, then Lolly.
Hey, Troy.
Hey y'all, how you doing?
Doing good. How about you?
Doing okay. Just want to say first of all, thank you for the personal blend.
Oh, good.
I got that and
How'd that treat you? Good?
smells great.
Yeah.
I just so far have just kind of like breathed on it a little bit, but is there any particular pattern or way of using it you'd recommend?
Yeah. Was it on the card or in the email?
Yeah, we give a little postcard.
Oh no. Okay.
Yeah, it's on the postcard.
Okay. I must have missed that. Okay.
And if it's in the trash, just let me know. I'll email
Yeah.
it to you. No problem.
So if I remember right, it's the heart, forehead, and back head, all three at the same time.
Forehead, back head. Okay. It's
It-
probably.
Samantha tells me it's longer, but
I could be wrong.
yeah,
I'll look
that's
through
the
my
gist of it.
I'll look through my stuff and find it, and if not, I'll email. Anyway, thank you so much for that.
You
Other
so
than that, I was just gonna ask, like, kind of do a check in with, like, my shoulders still hurting a lot, and my elbows, same thing, and I'm just feeling like kind of,
and have you been doing work on your neck? Have you been doing?
yeah, yeah. I've been doing all of it, and I've been doing additional things too.
And has that changed at all, or?
No, go ahead. Try again, Troy.
Yeah, we didn't hear a response.
Oh, okay. Sorry. I
There you
think I
go. There you go.
accidentally muted. Can you hear me now?
Yes.
Okay. Yeah.
So
So
with treating the neck, has there been any shift or change in the?
there has. It's just not lasting, and I'm just feeling like pretty high levels of pain, feeling like weakness in uh particularly upper body joints, but like, kind of stiffness and weakness sort of almost all over. And
Did you just do the org programming with the adrenal support?
I did, and I felt like a little bit calmer and stuff. I didn't notice a significant change in my um in the upper body joints. There could have been some. I just wasn't maybe enough that I was like, oh, that feels way better.
And do you use marjoram very much?
Oh, I like practically drink this stuff.
Okay. So boy, it still looks like your body's in pretty strong fight flight.
Yeah, I'm like just kind of confused by it and starting to get like a little bit of like the, kind of paranoia about it. Starting to kind of worry about it a little bit. And I've actually been like taking time off from work and had like a overall much lower uh stress kind of lifestyle this last month, and yet uh I've been my body has been acting as if it's the opposite, as if I've added more stress.
Huh. How's your sleep?
Or as per usual.
Yeah. Let's do an experiment of like over the next few nights, and then maybe we'll talk later at towards the end of the week. But as you go to bed at night, let's have you um, use Palo Santo.
Okay.
Inhale it into your body, into the different areas, but then do that pattern of Mingmen, back heart, and crown, just like
Okay.
over and over and over again.
Okay.
Like almost to the point, like if you lay down and you start doing it, like, breathe it into different parts of your body, but keep doing that Mingmen, back heart, crown until you start to fall asleep. Like, let's just see what that does over a couple of days.
Okay, doke.
Yeah, because like for whatever reason, boy, your body, it looks like it's in super fight flight.
Yeah, and
I
it's
mean,
like
that could be the pain. Like that's the thing is like, is it causing the pain or is it because of the pain? And at some point, it doesn't matter.
yeah.
It's just that it's there. But pain will definitely do that. And like you said, you're taking time off and it almost is having the reverse effect. That's a little bit like when you have a pain syndrome and then you lay down to go to bed, you don't have the distractions of the day and it almost becomes worse.
Exactly.
And so I would say experiment with the Palo Santo that way and mugwort. Like do mugwort, inhale it. You can go back and forth between the Palo Santo and the mugwort. But the mugwort I'd breathe into like the joints, the neck, the arms, the spine. Like breathe that in there. But the Palo Santo, that pattern up the back, Mingmen, back heart, crown.
Okay.
Yeah. Let's have you do that for a few days, and then at the end of the week, we'll talk see how that treated you.
Will do. Thank you so much.
And keep using the marjoram.
I will.
Okay, good.
Okay, thank you.
And then I know, guys, I just want to give everyone a kind of a idea. We do have a hard out at 8:15 to go
Yeah.
to the Stara blessings. So Lali, Priya, then Emiliana and Danelle. And if we don't get to your questions, like the ones you posted in chat, please email us and we'll do our best to get to
Yeah.
everybody here. So
Yeah.
Go ahead, Lali.
Hey, Lolly.
Hey, Wow, so many things, but okay, let's see. Let's connect it for a second to what we just talked about. So if we're talking about, all that's going on here in LA right now with all
Oh
the
man, it looks
fires
crazy
and
on the news. Like it looks so crazy on the news.
yeah, so it's a constant stress situation. So really when dealing with something like, trauma, whether it's, Israel and the alarm goes off, or whether it's, right here with all that's going on. So usually my go-to would be tarragon. But now I'm kind of thinking, what would be the difference? Like maybe adrenal support is actually a better
You could do
option.
adrenal support, but like what I would do like for something like that is like you said, you just came back from Israel where you're in a war zone and now
Yeah.
you're in a different war zone with all the
Mm-hmm.
fires and stuff, which is nuts. I would do not just tarragon, as I would do the PTSD support or the program. So tarragon, then rue, then hyssop, and then splendor. But we were even talking about this because we're wanting to kind of send some things out to people on the West Coast, and I have some firefighter friends, and then just the
Mm-hmm.
students, and it's just nuts. And
Mm-hmm.
so we're talking about like doing the PTSD kit, but then adding like the adrenal support as the program for it.
Mm-hmm.
Um,
Okay.
so you would still do the PTSD part, but
Mm-hmm.
you would add the adrenal support, and you would add I mean, I would probably do some form of like spikenard or myrrh or galbanum or red myrtle, violet leaf, like on the pattern of the brain, then spine, brain soles of the feet. And the idea being that you're calming down the spinal thalamic tract, which is how you process pain and how you process stimuli in the body and from the environment. And I would say that with everything going on, that's probably super over agitated, super, 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 overstimulated. And
Mm-hmm.
so spikenard on the feet. But I mean, you're still in an active situation. So it's not like, okay, it's over, let's
Yeah.
rest and recover. You're like, okay, let's rest, but you gotta watch the news and wait for, is there going to be some sort of an alert in the middle of the night for me to get out of the
Mm-hmm.
house, like so you gotta keep yourself as calm as possible until it's over, and then deal with the aftermath. And so again, I would go to those things, but until the fire's completely like resolved, it's going to be hard to pull yourself completely out of fight flight. It's
Yeah.
just marjoram would be another thing. I mean, I would just you know, surround yourself with all those things and just, just
Mm-hmm.
kind of keep going at it with all of that stuff, you
And
know.
then when you're doing the PTSD support, I mean, it's all inhalations, but then internally you would do what? Tarragon and adrenal
You
support?
could do tarragon, you could do spikenard, you could even do marjoram. Um,
So you would basically do all of them.
Yeah, like the thing with like spikenard, vetiver, valerian, they're going to be some of the more relaxing things. But the thing that I would also throw in that mix is galbanum, because galbanum is
Yeah.
about like physical pain, but like this is still kind of a pain that's coming from the environment. It's you're being super overstimulated by something that is out of your control, and it's not how you would traditionally think of pain, but it's still like a painful stimuli. You know what I mean?
Mm-hmm.
It's
Yeah.
And so I would do all that. Try to keep the breath deep, and there's got to be like crazy amounts of ash and toxicity in the air, Even just simply eucalyptus globulus inhaled for the, not for so much for the anxiety and stress and all that, but for lung function, especially to smoke exposure, just the good old fashioned eucalyptus globulus is really super good for that.
So you do globulus and not radiata for that.
What's that?
So you would do eucalyptus globulus, not the eucalyptus radiata.
Radiata would still be good, but globulus would probably be a little bit better. But if you don't have it, then use radiata.
No, I have them. I have it at least at one of the kits. Then it's fine. Yeah. Okay, so that's when it's better for the breath. Okay.
Yeah, I would say radiata is a little bit softer and a little bit more refined and a little bit more polite, where eucalyptus globulus is very very to the point. You know what I mean? It's not as refined, it's not as soft. It's about, kicking in the door, trying to clean things up. And for all that smoke exposure, plus there has to be just toxic things in the air. Gas lines rupturing, batteries burning, all those kinds of things. Like I would keep cleaning up the lungs. Yeah.
Okay. So then the other thing that also relates to that is really if we're talking about all those toxic things, if you need to do like some sort of like a detox, what would you?
I would do it after the fires are out. Like right now you're trying to survive the situations. You know what I mean? Like after it's all said and done, then we'll evaluate and have you go through and do like some detox. But right now, just like the globulus and all those other things, you got to keep your body as calm as possible as you get through this. Then afterwards, I'd go through and look at the detox and all that.
Okay, and then the eucalyptus, so you would do inhalations, diffuser.
Inhalation, I'd put it on the chest. Normally, I wouldn't say put eucalyptus globulus on the chest because it's so strong, but for this, I would. I don't. I'd put it on my feet. I'd put it on my abdomen. I would use it quite a bit.
Okay.
Yeah.
And then to deepen the breath, so really work with
out the PTSD thing.
Do that. Okay.
Just use the hyssop. Yeah. I mean, that's what the hyssop's for in that.
Right. And then the respiratory blend from the Auric programming, the stress, pulmonary stress support, use that as well? Kind of.
Yeah, if you have it, I would use it.
Yeah, I have Auric programming. Yeah. Okay.
It's not going to clean the lungs up quite like the eucalyptus because like you're cleaning something up that's like physically there. The pulmonary stress support is about like the respiratory tract having difficulty, your stress levels in the body and things like that, which is true. You do have that, but I mean, number one thing is you have toxic things in the air that you need to make sure that your lungs just aren't getting all gunked up with all those things going on.
Okay.
Yeah.
Okay. And then let's say you're doing work with somebody who's been through like, losing everything, all the trauma and everything, then you would work the same way and you would add
PTSD. Yeah, PTSD.
Okay, so you don't even need to add any more emotional stuff.
PTSD, I mean, eventually, but right now, PTSD kit.
Okay. Okay.
Like
Which I have these.
That's exactly what that's for.
Okay.
Yeah.
Perfect. Okay. And then
and also like if there's people that like submit their names to Astara for the prayer petitions, we have people doing healings. I've even pulled in some other people to do healings, so we're doing extra prayers, extra healings. So anybody just submit their name and we'll do the best that we can.
Okay. Thank you. Yeah, because I'm taking care of myself and at the same time, I'm taking care of other people.
Yeah.
So, which is why I need to make sure that I'm good to be able to give to others. Okay. Thank you. And then I guess I have one more second. Pain, which is moving to another direction for a second. By the way, also as far as like skin concern, that's related to stress. You would just treat the stress, not really.
I retreat the stress right now. Like
Okay.
again, the skin I deal with like
Yeah.
after.
Yeah. Okay.
Yeah.
And then just a quick question that's not related to that. Pain on the right top hand. It's been going on for a few weeks now. I wake up with that in the morning. It happens during the day. So it's on the, it's not an injury. It feels like maybe a tendon or muscle. I've been using some joint relief.
Mhm.
Not sure if I need to switch and maybe do the
I would
tendonitis
probably start
blend.
with like pain soothe or nerve help, but I would treat it from the neck all the way down, like the shoulder, the arm, heavy on the forearm, and then the hand itself. Like treat it all the way down.
Okay. And then do like ointment or body tonic type of thing.
Yeah. Yeah.
Okay. Okay, so from the neck down. Okay. I have more questions, but I'll just stick to those today and let's see.
Okay.
You have a few minutes. Thank you so much.
You're so welcome.
Thank you guys for being so considerate. And go ahead, Emiliana, then Danelle, if we have time.
Hi, how nice to be here. And thank you so much for everything. Two quick questions. I have a patient with a pretty strong case of receding gums, and I wondered what you would recommend for that.
Cypress is usually what we use for like receding gums. Like any sort of gum issue, especially if the gums start to get a little bit spongy and things like that. So you can have them just take the Cypress and put it on their finger and then just kind of rub it on the gums. But I would also have them take a couple drops internally.
Okay, would you recommend that like twice a day internally?
Yeah, twice. If they would do twice a day, that would be amazing.
Okay, like two
But at
drops?
least once a day. Yeah.
Okay, so 2 drops twice a day internally and on the finger and rub it on the
And
gums.
then just keep rubbing it in on, yeah, it's perfect.
And my second question is, often when I am needling an injury, working on an injury, I'm noticing that patients are clenching their hands, and I know that that's a defense. Like they're bracing for the pain, but often there isn't
Right.
any because I've used nerve help or I've used arnica, I've used,
Right.
like something on it to help. And I've used the health rays and to expand the area before I'm doing the needling. But I'm wondering about this is the first time I've heard of the trees oil.
The trees blend, and you know what might work for that as well, because some of that is anticipation, but some of it is also the pain itself. So the trees might be something that you could explore, but galbanum, which is in the family of frankincense, it really diminishes the pain sensation. One of the things that I used to do, like in person, is before I'd introduce them to galbanum, is I'd have them take their pen and press on their nail bed or poke their skin and go, okay, see how that feels. And then I'd have them inhale galbanum or put a couple drops on their wrist and then go back and apply pressure to the nail bed or poke with the pin itself. And you feel pressure, but you don't feel pain. And I think, the combination of doing something like that, you can have them inhale it, put a few drops. It doesn't even have to be near the area. It can just be like on the wrist or something, or you rub it like in their temples or something, and they'll start to have the experience of like, hey, it's not as painful as I thought, and eventually, the combination of diminishing the pain response and them having a couple of experiences where it's different, it should calm that down. Yeah, it should calm that down.
All right, that's what I've got tonight. Thank you so much.
You're so welcome. Keep us posted. Let us know if we can do anything for you.
Thanks, I will.
So we need to jump over. I'm so sorry if we didn't get to your question. Please email us and I'll make a point to answer them, in the morning or tonight or something. And so sorry, but
right now we are headed over. We're doing special blessings tonight. So it is blessing the Astara healing and prayer petitions, but it is also all week for Astara, we're doing special blessings and for the
fire on the West Coast. Yeah. So please join us if you can. Like they could use all the blessings we can give them. So thanks, you guys.